Billionaires pay zero in Medicare tax. While you pay on every dollar. What if I told you that a hedge fund billionaire making $500 million last year paid less in Medicare taxes than a minimum wage worker at McDonald's? Not less as a percentage. Less in actual dollars. In fact, he paid exactly zero. While you pay Medicare tax on every single dollar you earn, with no limit, no ceiling, no escape, billionaires have found a way to pay absolutely nothing. And it's completely legal. Today, I'm going to show you exactly how they do it, name the specific billionaires getting away with it, and reveal how much this is costing Medicare. Spoiler alert, it's enough to save the entire program. But first, let me show you something that's going to make your blood boil. Meet Steve Cohen. He owns the New York Mets. His hedge fund, Point72, manages $35 billion. In 2022, he made approximately $500 million. His Medicare tax bill? Zero. Zilch, nothing. Now meet Sarah Martinez. She's a registered nurse in Phoenix. She made $78,000 last year. Her Medicare tax bill? $2,262. That's right. A nurse making $78,000 paid $2,262 more in Medicare taxes than a billionaire making $500 million. How is this possible? It all comes down to a loophole from 1977 that nobody talks about. See, when you work a regular job, you pay Medicare tax on every dollar. No exceptions. If you make $50,000, you pay Medicare tax on all $50,000. If you make $500,000, you pay Medicare tax on all $500,000. There's no cap, no ceiling. It's 2.9% on everything. 1.45% from you, 1.45% from your employer. But hedge fund managers, private equity partners, they've figured out how to classify their income as something called carried interest. And carried interest isn't subject to Medicare tax. Let me explain exactly how this scam works. When Steve Cohen's hedge fund makes money for investors, he gets a cut, usually 20% of the profits. You'd think that's income, right? He's being paid for his work managing the fund. But through lobbying and clever accounting, they've convinced Congress that this isn't earned income. Instead, they call it investment income. And investment income, capital gains, isn't subject to Medicare tax. So while a plumber fixing toilets pays Medicare tax on every dollar, while a teacher educating our kids pays Medicare tax on every dollar, while a nurse saving lives pays Medicare tax on every dollar, a billionaire hedge fund manager pays zero. But wait, it gets worse. Stephen Schwarzman, CEO of Blackstone, made $1.27 billion in 2022. Medicare taxes paid? Zero. Henry Kravis of KKR made $450 million. Medicare taxes? Zero. David Rubenstein of Carlyle Group? $380 million income. Medicare taxes? You guessed it, zero. ProPublica analyzed tax data and found that the top 25 hedge fund and private equity managers in America made a combined $15 billion in a single year. Total Medicare taxes paid by all of them combined? Less than what a small town's teachers pay. Now, you might be thinking, okay, but how much money are we really talking about here? The Center for American Progress did the math. If we closed this loophole, if we simply made billionaire fund managers pay the same Medicare tax rate as nurses and teachers, it would generate $250 billion over 10 years. $250 billion. Do you know what that could do for Medicare? That's enough to eliminate the Medicare Part B premium for every senior in America for 3 years. That's enough to add dental, vision, and hearing coverage to Medicare permanently. That's enough to lower the Medicare eligibility age to 62. But instead, that money stays in the pockets of billionaires. Let me show you the math on just one person. If Steve Cohen's $500 million was taxed like your income, he'd pay 3.8% in Medicare taxes. That's $19 million from just one person in 1 year. $19 million that could help pay for cancer treatments, hip replacements, heart surgeries. Instead, zero. And here's what really infuriates me. They know exactly what they're doing. In leaked emails and recorded conversations, these billionaires openly brag about paying zero Medicare tax. One private equity partner was recorded saying, "The beauty of carried interest is it's not earned income. My secretary pays more in Medicare tax than I do." They're laughing at us. But it gets even more outrageous. Remember how I said employees pay 1.45% and employers pay 1.45%? Well, these billionaires have structured their funds so they're technically not employees. They're partners. So not only do they avoid the employee Medicare tax, they avoid the employer side too. It's a double loophole. A nurse pays 1.45% and her hospital pays 1.45%. A billionaire pays 0% and his fund pays 0%. Now, Congress has tried to fix this. In 2010, they added something called the net investment income tax, an extra 3.8% Medicare tax on investment income for high earners. Sounds good, right? Finally making billionaires pay their fair share? Wrong. These hedge fund wizards immediately found ways around it. They set up complex partnership structures in Bermuda and the Cayman Islands. They defer their carried interest for years to avoid the tax. They use something called management fee waivers to convert even more income into capital gains. The result? That 3.8% tax that was supposed to level the playing field? Most of them pay that on less than 10% of their income. Let me give you a real example from the ProPublica data. One billionaire fund manager had $800 million in total income. He paid the 3.8% Medicare tax on just 72 million of it. The other 728 million? Structured to avoid the tax completely. Meanwhile, that nurse in Phoenix? She can't set up a Cayman Islands partnership. She can't defer her income for a decade. She can't convert her wages into capital gains. She pays on every single dollar. But here's where it gets truly insane. These same billionaires who pay zero Medicare tax? They're going to use Medicare when they turn 65. They'll get the same benefits as that nurse who's been paying into the system her entire career. Actually, they'll get better benefits because they can afford the best supplemental plans and concierge doctors. So they put nothing in, but they'll take plenty out. And who makes up the difference? You do. Your Medicare taxes go up. Your premiums go up. Your benefits get cut. Also, billionaires can keep their loophole. Now, defenders of this system will tell you, but carried interest encourages investment. It helps the economy. Really? Steve Cohen needs tax breaks to motivate him to make $500 million? These guys would stop managing hedge funds if they had to pay the same Medicare tax as a nurse? Give me a break. The truth is, this loophole exists for one reason: lobbying power. The private equity and hedge fund industry spends $600 million per year on lobbying. $600 million to protect a loophole that saves them billions. That's a pretty good return on investment. They've bought senators. They've bought representatives. They've bought the tax code. And every time someone tries to close this loophole, they scream about killing jobs and hurting the economy. Meanwhile, Medicare is projected to become insolvent by 2031. In just 6 years, Medicare won't be able to pay full benefits. Seniors will see cuts to their coverage. Hospitals will see reduced payments. Some doctors will stop accepting Medicare, all while billionaires pay zero. But here's the thing. This isn't a partisan issue. Democrats and Republicans both agree this is wrong. Donald Trump himself called carried interest a loophole that's unfair. Barack Obama tried to close it. Even some billionaires admit it's indefensible. Warren Buffett famously said he pays a lower tax rate than his secretary. But nothing changes. Why? Because we don't make enough noise about it. We get distracted by other issues while billionaires quietly keep their loophole. Well, I'm done being quiet. And you should be too. Because this affects every single one of us. If you're working, you're paying more because they're paying nothing. If you're on Medicare, your benefits are at risk because they're not contributing. If you're approaching 65, you're facing higher premiums because the system is going broke. Also, Steve Cohen can buy another yacht. Let me put this in perspective. The Medicare tax that billionaire hedge fund managers avoid would pay for 2 million hip replacements, 5 million cataract surgeries, 10 million diabetes test strips for a year, cancer treatment for 500,000 seniors. That's not abstract numbers. Those are real people suffering because billionaires won't pay their fair share. And remember, this is just Medicare tax. These same people use other loopholes to avoid income tax, Social Security tax, estate tax. But Medicare is the most egregious because Medicare is going broke. We're literally choosing between billionaire tax breaks and grandma's healthcare. And we're choosing the billionaires. So what can we do about it? First, get angry. You should be furious. A system where nurses pay more than billionaires isn't just unfair, it's immoral. Second, share this video. People need to know this is happening. Most Americans have no idea that billionaires pay zero Medicare tax. Third, contact your representatives. I'll put links below to find your senator and representative. Tell them to close the carried interest loophole. Tell them billionaires should pay Medicare tax like everyone else. Fourth, remember this when you vote. Any politician defending this loophole is choosing billionaires over your healthcare. They're choosing hedge funds over hospitals. They're choosing private jets over patient care. Finally, don't let anyone tell you this is complicated. It's not complicated. Working. People pay Medicare tax. Billionaires don't. That's wrong, and it needs to change. The fix is simple. Treat carried interest as earned income. If you make money managing other people's money, that's income from your labor. It should be taxed like income from labor, just like a nurse, just like a teacher, just like everyone else. 250 billion. That's what we're talking about. 250 billion are stolen from Medicare to subsidize billionaires. While they tell you Medicare is going broke. While they tell you we need to raise the retirement age. While they tell you we need to cut benefits. The money is there. It's just in the wrong pockets. Steve Cohen doesn't need a tax break. Medicare needs that money. Seniors need that money. You need that money. It's time to take it back. Share this video. Make some noise. Because if we don't fix this now, Medicare won't be there when we need it. And the billionaires will still be laughing all the way to their tax-free bank accounts. Enough is enough. Make them pay their fair share. Our lives literally depend on it.